Welcome to Freetown International Hospital Emergency Department.
When it comes to emergency services, Freetown International Hospital should be your #1 choice. Our medical staff and nurses are fully ready to receive patients 24 hours round the clock. We take our time to do accurate diagnosis to save the life of all our patients. Our unit is equipped with updated medical machines to ensure correct examination for proper intervention.
Freetown International Hospital Emergency Department, we are ready to handle with all emergency cases.
Then get professional doctors them, the nurses them good, and then very caring. Since Akanaya, they take care of me, and the hospital really nice. The place really nice, the compound big.
We have a team of professional doctors and nurses ready to receive any emergency cases.
So you're welcome to visit us at 28B Beach Road, Lumley, Freetown, Sierra Leone. Or you can contact us on +232 33 400 400.
Our medical equipment are updated and our facility is accommodating for your comfort.
Freetown International Hospital, for be your choice.
Freetown International Hospital, close to you.
When every second matters, our emergency department is here for you. Our emergency department is available 24/7 and always you will be seen by professional doctors, even throughout the weekends. Our emergency team is covering a wide range of emergencies, including gynecology, general surgery, orthopedic, urology, cardiac, and GIT. With modern equipment, skilled specialists, we deliver fast and reliable care. Your health can't wait. Our emergency department is here for you, anytime, any day.
Hello, my name is Antonio Newson. My wife is Antonia Newson. We are patients here of Dr. Hamada at Freetown International Hospital here in Freetown, Sierra Leone. We were referred by a very good friend of ours who is a top nurse here in Freetown to Dr. Hamada and his staff at Freetown International Hospital. My wife was an emergency patient. She had to have an emergency delivery for our baby boy. So we put all our trust into Dr. Hamada and his staff, and our experience here was amazing.
I had an operation, and the operation, by God's grace and with Dr. Hamada help, it was painless. And I'm recovering well. I thank God for that.
I would recommend him to anybody, not just here in Sierra Leone, not just in Africa. Anybody come from abroad, you can be safe and assured that if you want your wife or your loved one to be under Dr. Hamada's care, not only for childbirth, but everything else he has under his expertise, you are 100% guaranteed. So we thank you, Dr. Hamada. We thank your staff. We thank you, Freetown International Hospital. We love you so much.
And I'm happy for let me even get opportunity for be part of this kind medical system na salon. Need not for me for go Turkey because I even contact some Turkey hospital them. Just think of how many $1,000 I for don't go pay. I able get her for a very reasonable price. I come with complications fibroid, ovarian cyst, and the rest. And anything associated with anything, and a lot of pain. They inside, they feel a lot of pain, and not be even able for pain go down. Where I can bleeding, and not be getting myself together. after the operation. I thank God. Then do the operation successful with no pain. No pain. The day when they do the operation, I able for map and waka. The very day of the operation. And I feel myself together. Things that I not be able to do before. Like I not be able for sit down straight so. I not be able for bend go down. I able to do all that day. Just after the operation, few hours after the operation, I able to do a lot of things. And I'm happy for let me even get opportunity for be part of this kind medical system na salon. Lead not there for me for go Turkey because I even contact some Turkey hospital them. Just think of how many $1,000 I for don't go pay. I able get here for a very reasonable price, low medication cost, and I get a family now. So friendly, the doctors are friendly. And before the surgery, the kind encouragement we go receive. The nurses, them friendly, you know.
I better get severe pain. When like for all day, okay, I go work on Thursday. Now they are get for faint. While they lead on this me belay so intense for me. I dey feel one kind way. I dey feel bad so much. I be there in so much pain, a lot of pain. But God direct we can at this hospital here so I come. So they say make I go do scan immediately. And Dr. Amada then take me inside the hospital. So they go do the scan and they find out say I get 2 months ectopic pregnancy immediately. An emergency operation. They say that next day I for do it because my blood be left something like a 5%. So they say I for do the operation immediately.
My name is Dr. Hamada Tail, consultant obstetric gynecology and infertility in Freetown International Hospital. This case, Marsa, coming at night for severe abdominal pain, crying from pain. I do examination and investigation, ultrasound, blood test, and after all this, professional diagnosis is rupture ectopic pregnancy. So fast, go to operation theater for the operation, excision for the ectopic pregnancy. After that, go to room. After 3 days, go to house. No problem, no complication.
From when they do this operation, say what thinking. I feel okay. Who said they mark me? Who said they stretch the mark? The mark don't loss. Right now, okay. I feel okay. Tell God thank you. This hospital is the best. Dr. Amada is the best, and Dr. Amada is so caring. Every day they take on me 3:10 in the morning, 10 and net before I ready for sleep. Oh, the nurses them, wow, bravo to them. They're really caring. They go check me pressure, me pulse. They ask me, matter you okay, doctor? They come. They're very caring. So me people them. Anything so far about operation, anything so far, una kind of Freetown International Hospital. For we the woman them who they look for born, Dr. Amada, he didn't also for we. Now the right doctor. Do ya a beg una come.
We will be carried now, my sister be the get bleeding. So that's much be worry away.
Today, I don't get myself for waka from here to yonder. I've been there, sit down on my own tire. Then my belly be big.
My name Umu Salema Tujalo. This is my lovely sister. Sister Khadija to Baye. So now my lovely sister, you know, be well, actually. The sick way will be carried here. My sister be the get bleeding. So that's much be worry away. But with time, with the Almighty align patients within your own time, be able to direct when at this Freetown International Hospital. We make who can see the gynecologist doctor, we then call Dr. Amanda. So we don't do all the tests them to run and find out in a cancer of the uterus and fibroid, meet say na be in problem. So through that day, the Almighty Allah help we and say if able to succeed on the surgery, now we be able to do.
I feel better now because I able to waka. So I don't get myself for waka from here to yonder. I've been there, sit down on my own tire. Then my belly be big. So now, wallahi, I tell God thank you. I dey sleep fine, I dey eat. I not been dey eat. I not been get appetite for it. But now, alhamdulillah, Rabbil Alameen, no bleeding, no nothing. I tell Allah thank you. I so appreciate anybody who want for treatment, good treatment, like Freetown International Hospital. The staff them good, the nurse them good, and they're always dinner, yeah. They're very, very good. So Amanda, thank you very much, and the staff and the nurses all thank you.
Actually, like I be look for way for my get belly, my way be born. But then I be dey feel the belly, we don't work on all the other hospital then. I no get no waiting safe, so we decide somebody direct we na we come na Freetown International Hospital. So we come, somebody recommend we to Dr. Amada. So where we come, then check me, do all my scan them, say na fibroid, say I forgot the operation.
My name is Dr. Hamada Tail, consultant of gynecology, obstetric and infertility. This case coming for the secondary infertility, suffering from abdominal pain, bulging. After ultrasound, after investigation, the professional diagnosis is multiple fibroid. Very bad for operation, and do operation easy, no problem. After operation, this case ISATA well and good, no any problem. I hope this pregnant after 1 year, inshallah.
I do the operation Tuesday. I work, I do well, no complication, nothing. Now I made this, they don't pull the fibroid. I will get multiple fibroid at the abdomen. They pull the fibroid. Now okay, see, I can see me now. Okay, I not feel no complication, nothing. And they do fine. I not even notice if they didn't do operation safe for me. Because that day I work, they did do the operation, I work. And no nothing. Very good hospital, and the doctor is very nice and good. So I just want to say thank you to the doctor and the nurses them and the hospital. They know how to take care of patients. The service is very good.
Show you that doctors Amada did a very perfect job by removing the devil. I call that the devil. So good. So thank God. I'm so happy. I'm so glad.
My name is Aisha Tajalo. I can do CS for deliver my baby boy. Alhamdulillah, the experience was smooth. The CS went well. A painless CS. Not a feel pain.
And this is my beautiful wife. We can at Freetown International actually for can do CS. As my reform very painless. And this the man have been worried so much. But Alhamdulillah, praise be to Allah, that a more successful one. And become very much happy and excited to be a father of this young man. And I tell Dr. Hamada, I plan to thank you again for the effort we make, and the nurses them as well for the caring we show towards my wife. Praise be to God.
My name is Kadiato Anifatu Bangura. Actually, I don't get this belly out for a long time. The tell where I can because all of Thursday, next for me to Friday morning, I not be able to sleep. This belly are so painful. I know they able to lay down and everything only pass a full by my belly. And I be feel serious pain. Now I tell me, "Mommy, out in the hospital." I say, "This don't pass. I know they able to sleep now." I say, "Any guy we go look for motor this next year." It don't take a long time from the time where they go school. Don't they pain me? Or they say infection, put me on treatment. The 10 hour can now say an assist, and I be done born. And they tell me say an assist. I get. Or I be the fear for the operation. So they put me on medication now over the counter drugs there.
My name Dr. Amanda consultant, gynecology, obstetric, and infertility in Freetown International Hospital. This case, Kadiatou Bangura, coming at night in severe abdominal pain and severe vomit, eye assessment, consultation, and ultrasound, and blood investigation. After this, I can diagnose, professional diagnosis is twisted ovarian cyst with complicated. Fast and hurry up, go to operation theater for do operation. The name of operation ovarian cystectomy. After remove of the cyst, this case is very good and go to house.
Dr. Amanda, when I the gynecologist, na a very professional doctor, a very accommodating, a really trying netly for figure out wetin are the thing. And to God be the glory, he able know wetin are the thing, he doing best. Because even when they're in the surgery room, the nurses them, the theater nurses, they say, oh, wow, we say for take 2 hours. We do one fast, 1 hour. Yes, they say really fast on my operation. And to God be the glory, I'm so happy. And I'm glad the way I come across her.
They say women are warrior, but some battle can be really tough for them. Some dey fight na dem quiet corner, with some of them issue them leg, fibroid, ovarian cyst, bleeding, and other pain them, wey for years now, dem still not able to talk about them or even get solution for them. Come, sit down. I get gist for you. Freetown International Hospital don't start for do laparoscopic gynecology surgeries them, and this one different from the way them plan to do them before. Today, na be open surgery. We go left you with one big scar and boku pain for some weeks. But this new method, na just small cuts with small pain, quick recovery, and almost no scar. If you dey experience issue like this, visit Freetown International Hospital.
So unfortunately, the Moscow break, then we don't die. Like the break, they not be work anymore. So we reach on that Jewel Road now. When we were going, try for mass the break failed. So end up sending Moscow down. So that led to the foot getting broken and I guess some fractures they were with me due to the accident today. The accident was gruesome, but thinking my life will succeed, I will survive, and I can at this Freetown International can get my surgery done successfully. Before I came to this hospital, yeah, I go various hospitals. I go there was no solutions. Like I will not get the equipment unless you get for travel, go Ghana, go other side. So yeah, was this my friend? We do kidney operation at the Freetown International Hospital. So I call him and explain to him. Say, well, okay, say you can go do one day. Freetown International, probably one of the best, if not the best hospital right now on surgeries and operations. I say, you sure? Say, yeah. Say, Freetown International Hospital, I really the best.
Mr. Kelly has a fracture around the knee, fracture tibial plateau in the upper part of the tibia, upper part of the knee. And it is the first case in Pan-Africa to do arthroscopically assisted fixation for the fracture. We use the scope to examine the joint, then we fix him by 2 plates and about 10 screws. Then we use the scope to assess the articular surface and to be ensured that the fracture is very well fixed.
Like I don't get overwork again, you know, that's all stress and all. But thank you with Freetown International. I can get my surgery done, and it was on August I get the surgery. So it takes like 1-2 months. They like today now, I can now find upright, and just want to tell the medical team at Freetown International, thank you very much. I really appreciate it, and I'm really grateful. So feel free, anybody who watches this video here, see I was just lying there, like I really left with no hope. But hey, with Freetown International, things can happen.
Well, this whole thing started 2017. The hour for take me was exam. Sick malaria, so I go admit for that. They don't treat me for the malaria at the hospital. Just one morning now a week for go wash. I feel my foot heavy. I not be able to calm down the bed. Pain, you know, the pain will be the face like current, like I know be worker.
Mr. Edward Mame, he is a 24 years old male patient. He presented to us with chronic hip pain for like 6 years, for which we did x-rays, and it shows something called avascular necrosis of the head of the femur, where the head of the femur become very necrotic and it's unviable anymore. And the cause of that was the sickle cell anemia, which he had. So the only treatment for this condition was to replace the hip joint with another artificial one, a procedure called a hip replacement surgery.
Before I be afraid really, I not really get the confidence. I say, you know, I really panic before the operation. When I be don't come for no say, I for can do operation, I be stressed a lot. You know, because I know me a person I not to believe in then today. Because if I can remember when the sick be on me, I go do scan in our hospital, the doctor be say, I don't get walker, but I use crutch or I use wheelchair. You know. So when I become for myself I can do this operation, I really panic. But thank God. I don't go successful. So I come for checkup. Now 2 months now after the operation, and much better. No more pain. And I'm able to do my daily activities then back. I would recommend that to anybody who knows say they struggle with bone, you know, we need an operation, I would recommend this hospital. Based on what myself the experience.
You dey experience lower back pain, leg pain, or you dey feel shock na your back take go down to your leg. This can be possible sign of lumbar discectomy. Wetin na lumbar discectomy? Lumbar discectomy na where your spine dey press by your nerve. This dey make you feel super pain and discomfort. The surgery recommendation for this problem, then call am endoscopic lumbar discectomy. This na how the surgery can go like. With the help of the x-ray, the doctor will make small cuts na your back and put small wire there, so he go see the right place outside the problem there. The doctor will slide one small stick wey dem call dilator per the wire. After, he go put another small tube over the dilator for form wood wey go meet the bad disc safely. Secondly, the doctor go put one small camera wey dem call endoscopy through a small passage wey he don make, so he go able see better one wetin he dey do. Lastly, doctor will use a special tool for pull the bad part of the disc where they press on the nerve. After this whole process done, doctor will remove all wetin he been put safely and lock the area back through stitches. If you dey experience issue like this, visit Freetown International Hospital.
We are here today to talk about a very important topic, which is fracture of the neck of the femur. The femur bone is the thigh bone, and it's composed of head, neck, and shaft. The head takes its blood supply from the neck. So when fracture occurs at the neck of the femur, this means that this head will die. So this is one of the few fractures that we can say it's an emergency fracture. It can occur in adults, young adults, by heavy trauma such as road traffic accidents, and it can occur also in elderly population by just falling to the ground. In young adults, we should fix this. What do you know about the relationship between the sickle cell disease and the hip disease? The sickle cell disease is a blood disease in which the blood cells becomes sickle in shape instead of being circular. This leads to decrease its ability to carry the oxygen, that's number one. And number two, this sickle type or this sickle shape causing the closure of the small blood vessels, which includes the blood vessels of the head of the femur. This leads to death of the head of the femur, which is called osteonecrosis. With time, the hip joint becomes damaged, causing severe hip pain and inability to walk. The treatment for such a condition in sickle cell patients is to do hip replacement after doing proper blood transfusion before the operation. For any information about this topic, it's now available in Sierra Leone.
Your hip gets two parts them, wey dem call femoral head and acetabulum. The femoral head na the top part of your leg, and the acetabulum na the hole inside the pelvis. Doctor dem usually dey do total hip replacement when arthritis or serious injury don spoil the joint sotey e hard for do normal day-to-day activity dem like waka, bend down or climb step. Inside this operation, doctor go pull the femoral head and acetabulum and replace them with artificial parts dem wey dem dey call prosthetic. This artificial hip prosthetic get two main parts dem. One cup wey dem dey call acetibular component and one metal rod wey dem call the femoral component. The doctor go cut around the hip area till reach the joint outside the acetabulum and femoral head dey meet. After, doctor go separate the femoral head from the acetabulum. Doctor go pull and clean all the bone or cartilage wey don spoil inside the acetabulum. Shape inside the socket proper one and fix the acetabular component with special cement or screw. Next, e go work on the femur. E go start for cut the femoral head and shape am proper so the prosthetic rod go fit. E go then secure the artificial femoral head with cement or use other methods. When the two parts dem don set proper one, the doctor go put the new femoral head inside the new socket. Finally, doctor go check how the hip dey move and confirm say everything dey in the right position with the help of X-ray. If you dey experience issue like this, visit Freetown International Hospital. You been don fall victim of any accident before? Motorcar accident, Okada accident, keke accident, spine problem, hip or knee problem, or been don fall down na tile or step? Well, now na you tell. Freetown International Hospital gets all the proper care wey you dey look for. For more information, you can visit our hospital wey dey near SOS School, opposite Golf Club, by police post, or call on the number wey dey na the screen so.
What do you know about knee osteoarthritis? It's a degenerative disease that affects the knee joint, leading to progressive loss of the articular cartilage lining the knee joint. It's more common in females, obese patients, and elderly population. The patient usually come with a complaint of knee pain, swelling, and stiffness. We clinically and radiologically evaluate the patient, including standing X-rays of his knee, to determine whether the patient is in the mild or moderate or severe stage. For mild cases, we advise the patient to do quadriceps strengthening exercises together with non-steroidal anti-inflammatory medication. For the moderate cases, we add intra-articular injections. For severe cases, we proceed for knee replacement. For any advice about this topic, now it's available in Sierra Leone.
Wetin you think say go happen with your life if unfortunately you end up by accident? And now, you find out say, you're not able to team up or waka. For move safe, don't turn trouble for you. According to findings, Boku people in Salon they suffer in silence with trauma and severe injuries them where they affect their daily life. Well, get good news for you. Freetown International Hospital get a team of orthopedic doctors them we get the know-how for handling kind issues they are so. Issues them like bone fracture, joint replacement, low back pain, and spine problem. If you experience issue like this, visit Freetown International Hospital.
When a bike hit me down, where I get this dislocation or it's in broke foot. Now when I go hospital, I know say I get the bone broke. Well, I go through a lot because the pains where I go through, about 3 months I did in a house to try to find solution. Or to wait for the time where Freetown International will call me for a surgery because for let them put date. So I've been in a house all this while, wait for the date. And a lot of pains. Hard to explain. Well, then do my own surgery on the 27th of July, 2024, on a Saturday. Total hip replacement surgery. Because my hip, closer to my hip, now the bone broke. So we not for patch and pass and remove them and replace out something them. The 2 weeks when they tell me for return back in the hospital back they surprised them. The nurses and doctor then surprised. They said I work out one crutch, didn't step at the foot. So even the doctor themselves, they give me a call it, oh, then congratulate me. People who get accidents of that kind of nature, like bone fracture, bone break, I would recommend people because mine is successful now at the worker after 63 days. I can work out with walking stick, I drop myself and I work out with walking stick, but doctor said no, let's minimize them first. So, yeah, well, after God, I would say thank you to Freetown International Hospital because if you see I smile now, at the work and I don't begin do business, I would say alhamdulillah. After God, not them.
Actually, the motor car hit me up. Me say believe I'm your motor car. I get a flat tire, so I try to change them. And the other motor car hit me. Yeah. Well, at first, when the thing just happened, now one side I lay down, I know the sit down, I know the team up. So I get admitted here so for like 5 days and do all the tests then and then scan then the X-ray, everything. So then assure me say they able to do the operation. So with that we go to the operation room, the theater. Then they do the operation, just exactly what they tell me before the operation, and I end up for C. We are in a day after the operation. Then I will grab the ASME I grab. Then 2 days time I discharge. I go to host. They are beginning to respond to treatment now. They like today, alhamdulillah, look Saturday. I can sit down for myself. I the team up for myself. Then I the worker for myself now. Yes, I would recommend Freetown International for people that will get them similar things that or other sick themselves. Because I don't see them services and the services are very good and very reasonable for at least to the service they provide to people then, and the staff them very, 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 very professional. Experience been so good. Alhamdulillah, we got people who direct me for Kenya, so the experience is so good. They treat me very nice. Anyways, yeah.
Mina Aguna Bangla Kama, a footballer. I represent Sierra Leone. I go do some save. We like a fly, we for them, we calm down. So like I begin feel this pain half for me. So time gone, I'm not able to my foot then the heart. This injury I don't take close to 2 years now. 2 years ago was taken up.
He came with a serious spine issue called spine spondylodiscitis, and his main issue was a chronic back pain that stopped him from playing football since 2021. This is very serious. He was not able to walk freely or properly. Our professor, Dr. Ala Abulhamd, was a spine consultant who did the surgery for him. The surgery involved that the professor did a decompression for the nerves and fixed the bone and removed the infection from the spine and from the disc. And the surgery went very smoothly, and it only took 2 hours or 2.5 hours. And the patient, after this surgery, became very well. He will be able to start playing football again.
I always tell the doctor and plenty thinking at Freetown International Hospital. I dey like to that smile to people then. Everybody they see me real face. First time you see always my face too dark because easy. I will suffer pain so long. Over 3 years I suffer injury. Today, they like today, everything is over for me. We stand back, I tell the doctor then plenty thank you Freetown International Hospital. And don't forget to come Freetown International Hospital. All kind sickness they remain, all kind bone they remain, spine, any kind they take care of me.
Freetown International Hospital, which is located at 28 Beach Road, Lumley, Freetown, is here with its cardiologist specialists specialized for any heart disease. Some of our services include diagnosis, treatment, and follow-up of hypertension, acute and chronic cardiac patients, chest disease, renal impairment and diabetes, rheumatic heart diseases and heart attack in childhood, preventive and corrective measure for renal impairment, hyperlipidemia, and morbid obesity. To ensure smooth diagnosis, the doctor uses advanced medical machines like ECG, electrocardiogram, echocardiogram, mechanical ventilator, which is to help the lung function for patients in coma. Our doctor is specialized in performing safe and reliable CBL procedure. Our customer service is second to none. Our doctors and staff are very professional, and all your medical diagnoses are highly confidential. So for more information, you can visit us at Freetown International Hospital, which is located at 28 Beach Road, Lumley, Freetown, or you can contact us on +232 33 400 400, or you can visit any of our social media handles at Freetown International Hospital. Freetown International Hospital, close to you.
Every second matter where e camp and chest pain issue. If you ignore am, e go change your life forever. Sometimes then day, you go feel say na stress. Then day, you dey feel tightness na your chest, or you go feel say na something bad na you eat. But wait o, it can be say the chest pain wey you dey feel na other thing na im dey cause am. Na Freetown International Hospital, dem get doctor dem wey get the know-how and they work 24/7 for give you the right treatment at the right time. If you dey experience issue like this, visit Freetown International Hospital.
Hello, Assalamu alaikum. I am Dr. Hussein Sulaiman. I am a cardiology and ICU specialist. We will talk today about heart failure. Heart failure means that the heart muscle doesn't pump blood as well as it should. The blood often backs up and cause the fluid to build up in the lungs and in the legs. It will affect your lifestyle and can cause many complications up to death if it left untreated. So you should aware about the symptoms of heart failure. If you have at least one of them, you should seek the cardiology doctor. Shortness of breath, swelling in your legs, can't lie flat on your back and get tired with ordinary exercises. So you have to visit your doctor and check it regularly to avoid all these complications.
You don hear about am plenty time, but wetin exactly na hernia? Hernia na like a ball wey dey inside damaged tire, wey the inner tube or soft tissue normally get strong rubber wey can comot nado wey the tire shell. Na so back so e dey comot nado like big boil na the body. This can be painful if dem left am so and not treat am. Na two way dey for operate this hernia. The first way na open surgical repair. Through this operation, the surgeon go cut the skin and put artificial parts na the bottom belle. This dem can do am for small and big hernia, and even for person wey don do hernia surgery before. The second one, dem call am laparoscopic surgery, wey the surgeon go put small tubes dem wey dem dey call cannulas inside the bottom belle. The operation dey take place through dem tubes here so, wey dem put inside the belle. Dem dey use am for small and big hernia operation. This type of operation here so get low rate of wound infection, dey mend quick one pass open surgical repair. After this, patient go about dem business like dem job so after 1 week, and even go start for exercise after 2 weeks of the operation. Appendix na one small thick flat bag wey dey na the left side of the belle. Burning, obstruction and other infections dem inside the belle can block the opening of the appendix, wey dey lead to one dangerous sickness wey na appendicitis. This can shell and scatter infection inside the belle. If you get appendicitis, your doctor go perform operation wey dem call appendectomy. During the appendectomy, your doctor go pull your appendix through open or laparoscopic procedure. With the open appendectomy, the surgeon go cut the skin na your belle, pull the appendix, and go take time for make sure say no infection no escape go inside your belle. After the operation, the doctor go lock the belle back. For laparoscopic appendectomy, the doctor go make small cut na the belle and put small camera dem inside it, wey go help am for see inside your belle and use special tools for pull comot your appendix. After that day, the doctor go lock the small cut dem back. If you want.
Hello everyone, today we'll speak about breast lumps. Breast lumps is a topic that usually worry you, especially women, but it is often misunderstood. Breast lump is abnormal feeling of abnormal mass or thickening in one breast or both breasts. It usually comes from infection. It may come also from abnormal hormonal response or even abnormal cell growth, and some come from injury or trauma. Usually the woman feel abnormal feeling lump or mass in one of or both breasts. Sometimes there is asymmetry between the right breast and the left breast. Early evaluation is important for proper treatment. The proper treatment sometimes include just medication tablet, sometimes it includes taking biopsy to confirm the diagnosis, and sometimes it includes surgery to remove the lump. If you feel abnormal lump in one or both breasts, don't panic. Just visit the surgery clinic to start the evaluation. This service is available in Freetown International Hospital. Hello everyone, today we'll speak about abnormal nipple discharge. Abnormal nipple discharge is a noticed fluid that comes from the nipple away from the breastfeeding. Sometimes it is watery discharge, sometimes it is blood, sometimes it is a mixed discharge, some like milk, some like water, some like blood. Abnormal nipple discharge is a sign of a problem, especially if it comes from one side and it requires evaluation. The evaluation includes sometimes we prescribe mammogram or ultrasound scan, sometimes we prescribe hormonal AC for abnormal nipple discharge. Usually the causes of abnormal nipple discharge. Sometimes it is stress. Sometimes it is abnormal hormonal response. Sometimes it is a hidden lumps or tumors. Sometimes it is infection. So whatever the cause, don't hesitate to visit the doctor. The treatment of abnormal discharge, it includes first to reach the diagnosis. Secondly, to treat the cause of the abnormal nipple discharge. Sometimes it is only enough to take some medication or tablet, and sometimes it requires small surgery to correct the problem. This service is available in Freetown International Hospital.
Gallbladder na one small pear-shaped bag wey dey on top of your belle under your liver. The gallbladder in work na for keep digestive juice called bile wey the liver dey make. When the system need am, the gallbladder dey send am through the common bile as e dey help the body for digest food. Gallstone na triangle mass wey made of cholesterol and bile salt wey can move and block the flow of bile na the gallbladder. This blockage most common per woman dem. It can lead to pain na the back, abdomen, and shoulder blade. If this stone here boku per you, serious wahala can happen. If you get gallstones or gall problem, your doctor go advise you for do gallbladder operation. If na laparoscopic cholecystectomy, your doctor go perform the operation through 4 small cuts na your belle. Then fill your belle with gas for see clear one. E go use tiny telescope wey connect to video camera as a guide. Your doctor go then put other instruments dem na the cuts and go pull the damaged gallbladder. After that, doctor go pull all the gas and lock the cuts dem back. Another way for pull gallbladder, dem call am open technique. This way, the doctor go make cuts under the rib cage and pull the gallbladder. Then, e go lock the cuts with tapes or stitches. Hemorrhoid, wey dem also can call pile, dey happen wey the veins dem inside the waist swell and become painful. If this swelling of your vein happen inside your waist, dem call am external pile. But if the vein na within the rectum, then na internal pile. The first degree internal pile na the one wey can always dey inside the waist. The second degree can comot outside the waist wey person dey go toilet and return back inside by himself. The third degree internal pile in dey comot na door during wey person go na toilet and pass dem push am inside. Fourth degree internal pile always dey na door and no dey go inside even if dem push am. Before dem operate am, doctor go give you medicine wey go put you per sleep through breathing mask or IV line. Doctor go put breathing tube inside your windpipe for help you breathe the time wey the operation dey take place. During the operation, the doctor go use a scalp bowl or laser for cut the tissue inside the pile for show the vein wey swell. The doctor can tie the vein wey swell make e no bleed wey dem put am. When the doctor done, e go put bandage per the wound make e well quick one and no get any infection.
Na the 12 years this sooner when we start farming, I bin feel say na well wey dey scatter. I bin buy happy cloth for take am for scatter, but e no be able scatter. At times, well, why I lay down, get me the net. If I lay down at this part, so I no go able sleep because I can choke. If I dey itself, it can choke me. First I dey drink water, fast. I dey eat na so I dey drink water. Because it can mona me. Don't know I can walk on the streets. According to how people dey look me, pikin dey watch me, I can shame. Some people dey tell me say wey is small, wey dem go do your operation. At times they blind or they crazy.
Our patient Aissatou Karbo, a female young patient, presented with very huge goiter, neglected case, with what is called retrosternal extension, so that the patient has some part of the gland going down in the chest. Many surgeons refused to do her the surgery, and she suffered for a long time, more than 12 years, and by Allah power, we could send her to the theater and remove the thyroid gland completely without any obvious complication, no bleeding, no voice change, no breathing abnormalities, and everything was okay. Even the stitches we did for her, we usually use special cosmetic threads and do fine scar, and it is hardly difficult to notice that the patient had any surgery before in his neck.
So right now, when they don't do am for me, I feel fine. Say God thank you now. Like I didn't know where I don't been get am. That's how I feel. I say thank you to Freetown International Hospital, to Mr. Ibrahim, the doctor. So right now, I tell them thank you because of what they don't do by this operation.
I was experiencing some unusual pain from my neck. Sometimes to swallow food, sometimes normal exercise, which I normally do, get less. Laziness start developing. I was even having some problem with my wife. So on that content, I discovered this my goiter start developing, protrusion. And when I took this matter to my mother, the first time I explained that to her, he said, hey, your auntie was having this. He spent his whole lot of times and died. He never complained of anything. Why are you complaining? I said, no. I said, no. I said, I'm very young to have a thyroid, to have my neck swallow. I said, I look more ugly. I said, in fact, I said, can't you see me when I'm dressed? I normally tied up my neck. I said, I hate public. I said, I hate to go to public now. I said, I don't want to maintain this.
Patrick Marahi is 37 years old. This patient presented to us with thyroid goiter and increased activity of the thyroid gland. The best choice for our patient was to remove the whole gland surgery. We successfully could do the surgery, and we removed almost 100% of the thyroid gland, and we enable our patient to return back to his normal activity, normal life, without any drawbacks, without any problems. Even the stitches, we did do the minimal scar because we use cosmetic stitches and cosmetic threads to give the patient the best result for his neck scar.
Thanks for Dr. Ibrahim, and thanks for Freetown International Hospital. Actually, I want to emphasize this. If you have thyroid, come to Freetown International Hospital.
Hello everyone, today we'll speak about breast lumps. Breast lumps is a topic that usually worry you, especially women, but it is often misunderstood. Breast lump is abnormal feeling of abnormal mass or thickening in one breast or both breasts. It usually comes from infection. It may come also from abnormal hormonal response or even abnormal cell growth, and some come from injury or trauma. Usually the woman feel abnormal feeling, lump or mass in one of or both breasts. Sometimes there is asymmetry between the right breast and the left breast. Early evaluation is important for proper treatment. The proper treatment sometimes include just medication tablet, sometimes it includes taking biopsy to confirm the diagnosis, and sometimes it includes surgery to remove the lump. If you feel abnormal lump in one or both breasts, don't panic. Just visit the surgery clinic to start the evaluation. This service is available in Freetown International Hospital.
Colonoscopy na procedure wey doctor can do for check for problem inside patients in bottom belle. Why doctor can do this test per patient? Doctor can do this test per patient for check for problem dem like serious belle heart problem. If blood can comot na the patient in waist, wey with man can call rectal bleeding. If the patient no dey go na toilet for himself, wey also dem dey call constipation. If the patient dey experience loss of weight, like im body just dey dry normal, or e dey suffer from chronic diarrhea. Colonoscopy procedure dey also help doctor for identify inflammation or infection, early stage of cancer, and any developing problem na the patient in belle. How the test dey go like? Doctor dey use one machine wey dem dey call endoscope. This na one long soft pipe wey get camera na the head. This camera go help the doctor for see inside the patient in belle. During this procedure, doctor go give the patient anesthetic wey go make e no feel any pain whilst the procedure dey go on. If the doctor see any growth wey with man can call polyps inside the patient in belle, e go remove am one time and take small sample for biopsy if needed. If you dey experience issue like this, visit Freetown International Hospital or call on +232 33 400 400. If dem tell you say 30 minutes go save you life, you go believe? For reduce such risk, colonoscopy na the answer. Stomach cancer common, but e also preventable. And colonoscopy na the best way for reduce the risk. During this short procedure, doctor will give the patient light anesthetic wey go put am to sleep. Doctor go then insert one flexible rubber wey get camera na the front head, so dem go see right inside the patient in belle. Why person for do colonoscopy? Colon cancer can happen to anybody. It can even affect person wey no get family history of cancer. According to statistics, colorectal cancer, wey na cancer wey dey affect the belle, na the second most common cause of cancer deaths na the world. Even though na people dem wey don pass 50 years e can ambog, this BNTM e don common to younger people dem. Colonoscopy can help for prevent colon cancer. During this procedure, the doctor go able spot and remove small growth wey dem dey call polyps wey can develop na the belle or the rectum. If dem no see am early, e go grow and turn cancer. But if dem pull am as early as possible, e go reduce the risk of cancer. You no go able rely on signs or symptoms because polyps and early colon cancer no dey show any signs. Na that make e important for check am as early as possible. Colonoscopy na the best way for check colon cancer. Dem call am the golden standard because e dey see over 95% of cancer cells dem na the belle. Colonoscopy na a very safe procedure. For screening, you can visit we na Freetown International Hospital wey dey near SOS, opposite Golf Club by police post. Upper endoscopy na test wey doctor can use one thin long pipe wey dem dey call endoscope, and this pipe get light and small camera na the edge of am. Doctor go put this pipe inside the patient mouth, through in throat, go down to the patient in belle. Why doctor dey do this test? Doctor dey do this test for check for problem dem like swelling or growth, and nausea, acid reflux, belle heart or bleeding. This na a very short procedure wey in time range na approximately 30 minutes. At the start of the procedure, doctor go give the patient anesthetic for put am to sleep, so e no go feel any pain while the procedure dey go on. Doctor go get for use one spray for numb the patient in throat, so e no go feel one pain. After the patient don fall asleep, doctor go turn am on im left side. E go open im mouth, put one rubber guard for protect im teeth dem, and e go carefully pass the endoscope through im mouth go down to im belle. doctor go blow some ear through the road outside the endoscope dey pass for see clear one. The endoscope go send picture dem of wetin doctor dey do na one big TV screen. Na the screen doctor go look for any suspected problem inside the patient in throat take go down to im belle. If doctor see anything wey not correct, e go take small sample for send am na lab. If na growth, e go remove am. If you dey experience issue like this, visit Freetown International Hospital.
Boku people dem don dey experience pain na dem kidney and dem bottom belle. Pain wey dem dey wet, same way so boku man dem no dey able for give belle and other male conditions. So, Freetown International Hospital now don get urology and urology specialists wey in your work na for treat stone dem wey dey na your kidney or infection per man. This doctor able for treat man wey na okobo or man wey in tin no dey tin up or man wey even get them bad belle at. So if you dey feel pain or see blood wey you dey wet, pain na dem bottom belle and dem kidney. Na for rush now can see we na Freetown International Hospital wey dey 28B Beach Road, Freetown. Or you can call Ripan +232 33 400 400.
You na man wey no dey function well, no lose hope because not to the end of the world for you. Freetown International Hospital get sober professor wey get the know-how for treat this kind problem here. For book appointments, you can call on +232 33 400 400 or visit we na we hospital wey dey near SOS School by Police Post opposite Golf Club Lumbly. If you get stone inside your kidney or urethra, the doctor will recommend one procedure wey dem call ureteroscopy. Na procedure wey dem dey use camera for see inside the person in body. The pipe wey get the camera go pass through the road wey you dey wet, wey dem call urethra, and go inside the bladder. Then go up to the urine pipe wey dem call urethra or even reach the kidney. This na how the procedure can go. The doctor will give you sleeping medicine wey we dey call anesthetic, so you no go feel nothing when the operation dey go on. The doctor go also pass one small tube wey get camera inside am from the side where you dey piss, go inside the bladder, then pass through the urethra and reach to the kidney. The doctor can use one clear liquid wey dem dey call contrast or dye or see better one how the stone talek na the kidney. Dem can also take x-ray picture for know exactly outside the stone dey na the kidney. When doctor see the stone, dem can use one instrument wey dem call stone basket or pull the stone directly, or they use laser for broke am half one before dem go pull am. After dem don pull the stone, dem go check the patient proper one for make sure say nothing no left behind. After all this procedure, the doctor go fix one temporary pipe wey dem call stent within the patient in urethra so swelling or blockage no go take place. Dem also get for put catheter inside the patient in bladder for go dey help am piss, but dem go get for pull am back after some time. Finally, the patient go get for left the hospital after e don feel better. If you dey experience issue like this, visit Freetown International Hospital. This video will tell you small thing but one ultrasound wey dem dey call obstetric ultrasound. This obstetric ultrasound na procedure wey doctor can use for check woman wey get belle. Doctor can use this procedure also for tell the woman im pikin im gender, the time wey e go born the pikin, if the pikin don find inside the belle, and plenty other things dem wey the woman go want for know about im belle issue. If you na belle woman and want for do this procedure, visit Freetown International Hospital wey dey near SOS opposite Golf Club by police post, or call on +232 33 400 400. Wetin na abdominal ultrasound? Abdominal ultrasound na one test wey doctor dem dey use for check body problem dem. E safe, e quick, no radiation, and e painless. Why doctor can ask for do abdominal ultrasound? Doctor can ask for do abdominal ultrasound because of dem reason here: kidney stone, liver problem, tumor, gallstone, and plenty other belle heart issues dem. We get different type of ultrasound tests dem, and we dey use different probe for each test. This na how the test dey go. The person wey dey do this test, dem call am sonographer. The sonographer go rub one gel na the area where the patient complain about. While this procedure dey go on, the machine dey send sound wave inside the body, and then the sound wave dey bounce back, and this go show live picture where the doctor go see na the screen. If you dey experience issue like this, visit Freetown International Hospital or call on